Meet Marcos, 50 years old, always active at work, a family man. But for some time now, he's noticed that his energy has dropped, his sexual desire has decreased, his erection isn't what it used to be, and he feels less of a man. He consulted a doctor, was informed that his testosterone might be low, but he thinks, "I'm aging and it's normal." What he didn't know is that low testosterone has profound implications for male sexual health, and that acting early can turn the game around. In this video, you're going to understand the truth about low testosterone and how it impacts your sexual life. And not just that, how it can affect mood, muscle mass, body fat, overall vitality. We'll address how testosterone is produced, its functions in a man's body and in sexuality, including desire, erection, and orgasm. We'll cover signs that your testosterone may be below optimal, drop in libido, sporadic erections, fatigue, irritability, increase in abdominal fat, loss of muscle mass. We'll explain why many doctors and men ignore low normal and believe that it's just aging. But there are optimal levels, not just acceptable ones. We'll discuss what to do, correct tests, interpretation, target levels, when to supplement or treat, plus lifestyle factors including nutrition, quality sleep, minimizing stress, avoiding toxins, exercising, especially strength training, optimizing micronutrients. We'll present an action plan for Marcos and for you. Weeks 1 through 2 assessment. Weeks 3 through 4 lifestyle changes. Weeks 5 through 8 monitoring and adjusting, when to seek a specialist or consider medication. If you're living what Marcos is living or you recognize these signs, stay until the end. I want you to know there is hope, there is a plan, and you can recover your sexual vitality. At the end, comment. What is your biggest pain related to testosterone or sexual desire? What do you feel you're losing? I want to know so I can help you. Let's begin by understanding what testosterone really is and why it matters so profoundly to men's health, particularly sexual health. Testosterone is the primary male sex hormone, an androgen produced mainly in the testicles with a small amount produced by the adrenal glands. It's responsible for the development of male characteristics during puberty, including deepening of the voice, growth of facial and body hair, increased muscle mass and bone density, and development of the male reproductive organs. But testosterone's role doesn't end after puberty. Throughout a man's life, testosterone continues to play crucial functions in maintaining muscle mass and strength, bone density, fat distribution, red blood cell production, sperm production, and critically for our discussion today, sex drive and sexual function. Testosterone is intimately connected to virtually every aspect of male sexuality. It influences libido or sexual desire, the spontaneous interest in sexual activity, and responsiveness to sexual cues. It affects erectile function, working synergistically with the vascular and neurological systems that produce erections. It impacts orgasmic function and sexual satisfaction. It influences mood, energy, and confidence, all of which affect sexual experience. When testosterone levels are optimal, men typically experience robust sexual desire, reliable erectile function, satisfying orgasms, good energy and mood, maintained muscle mass and strength, healthy body composition with less abdominal fat, and overall sense of vitality and well-being. Marcos represents millions of men who are experiencing the gradual decline in testosterone that can occur with aging, but also the additional drops that can result from lifestyle factors, medical conditions, medications, and environmental exposures. His story is common. He's noticed changes, but attributed them to inevitable aging, not realizing that while some decline may be age-related, significant symptoms are not normal and can often be addressed effectively. The medical community has historically had a complicated relationship with testosterone. For years, low testosterone or hypogonadism was only diagnosed and treated when levels were severely low and symptoms were dramatic. Men with levels in the low normal range, even if they had significant symptoms, were often told everything was fine. Fortunately, understanding has evolved, and there's increasing recognition that optimal testosterone levels exist on a spectrum, that symptoms matter more than arbitrary cutoffs, and that maintaining healthy testosterone levels is important for overall health and quality of life, not just sexual function. So what are the signs that your testosterone might be below optimal? Let's go through them systematically. The first and often most noticeable sign is decreased libido, or sexual desire. You might find that you're just not thinking about sex as much as you used to. You don't initiate intimacy with your partner. You feel indifferent when sexual opportunities arise. You'll have to work hard mentally to get interested in sex. Your spontaneous desire, that feeling of wanting sex out of the blue, has diminished or disappeared. You might still be able to respond to direct sexual stimulation, but that spontaneous drive is gone. This is one of the most common symptoms of low testosterone, and often one of the most distressing, because sexual desire is so tied to masculine identity and relationship satisfaction. The second sign is erectile difficulties. Now, low testosterone doesn't typically cause complete erectile dysfunction on its own, but it can contribute to erectile problems in several ways. Testosterone is involved in the nitric oxide pathway that's essential for erections. It affects the health of the vascular endothelium, the lining of blood vessels. It influences the sensitivity and responsiveness of erectile tissue. Men with low testosterone often report that their erections are less firm, don't last as long, or require more stimulation to achieve. Morning erections, those spontaneous erections during sleep and upon waking, often decrease or disappear with low testosterone. You might find that you can achieve erections with direct stimulation, but don't have the spontaneous erections you used to have. It's important to understand that erectile dysfunction can have many causes: vascular, neurological, psychological, but low testosterone can be a contributing factor and should be evaluated. The third sign is decreased energy and increased fatigue. You might feel tired all the time despite getting adequate sleep. You lack the motivation and drive you used to have. Tasks that used to be easy now feel exhausting. You need more caffeine to get through the day. You'd rather sit on the couch than do anything active. This isn't just feeling tired after a long day. It's a persistent lack of energy that affects your daily functioning and quality of life. Many men don't realize this fatigue could be related to testosterone because it seems so general and nonspecific. The fourth sign is changes in mood and mental state. Low testosterone can contribute to irritability, feeling short-tempered, or easily frustrated. Depression, experiencing persistent sadness, hopelessness, or loss of interest in activities. Anxiety or increased worry. Difficulty concentrating or brain fog. Decreased confidence and self-esteem. These psychological symptoms are often overlooked or attributed to stress, aging, or life circumstances. But testosterone has significant effects on brain function and mood regulation. And low levels can have real psychological impacts. The fifth sign is changes in body composition. You might notice increased body fat, particularly abdominal, or belly fat, that spare tire around your middle that won't go away despite diet and exercise. Loss of muscle mass and strength, finding it harder to build or maintain muscle even when you're working out. Your body just doesn't respond to exercise the way it used to. You might also notice decreased bone density over time, though this isn't usually noticed until it becomes severe enough to cause fractures. These body composition changes aren't just cosmetic. Abdominal obesity in particular is associated with numerous health risks, including cardiovascular disease, diabetes, and metabolic syndrome. And it also further lowers testosterone, creating a vicious cycle. The sixth sign is reduced physical performance and recovery. You might find that your workouts are harder, you're not making progress despite consistent effort, you're weaker than you used to be. You take longer to recover from exercise, you get injured more easily, or you just don't have the physical capacity you once had. Testosterone is anabolic, meaning it promotes muscle growth and repair, so when levels are low, physical performance and recovery suffer. Other signs can include decreased facial and body hair growth, though this is highly variable, and genetics play a large role. Breast tissue enlargement or tenderness, called gynecomastia, which occurs because low testosterone shifts the hormone balance toward relatively more estrogen. Hot flashes or night sweats, similar to what women experience in menopause. Sleep disturbances, difficulty falling or staying asleep. Decreased testicular size in some cases. If you're experiencing multiple of these symptoms, particularly the sexual symptoms combined with changes in energy, mood, or body composition, it's worth investigating whether low testosterone might be contributing. Now let's talk about testosterone production and what affects it. Testosterone production is regulated by the hypothalamic pituitary gonadal axis, often called the HPG axis. The hypothalamus in your brain produces gonadotropin-releasing hormone, or GnRH. This signals the pituitary gland to produce luteinizing hormone, or LH, and follicle-stimulating hormone, or FSH. LH travels through the bloodstream to the testicles and stimulates the Leydig cells to produce testosterone. FSH works with testosterone to support sperm production. It's a feedback loop. When testosterone levels are adequate, the hypothalamus and pituitary sense this and reduce their signals. When testosterone is low, they increase signals to produce more. This system can be disrupted at multiple points. Primary hypogonadism means the problem is in the testicles themselves. They're not responding adequately to the signals. Secondary hypogonadism means the problem is in the hypothalamus or pituitary. They're not sending adequate signals. There's also functional hypogonadism, where the HPG axis is suppressed by factors like obesity, chronic illness, medications, or stress. Testosterone levels naturally decline with age, typically starting around age 30, decreasing by about 1% per year on average. However, this gradual decline is different from the dramatic drops that can occur due to other factors. What causes low testosterone beyond normal aging? Obesity is one of the most significant factors. Fat tissue, especially visceral abdominal fat, contains an enzyme called aromatase that converts testosterone to estrogen. The more body fat you have, particularly abdominal fat, the more testosterone gets converted to estrogen, and the lower your testosterone levels become. This creates a vicious cycle because low testosterone makes it easier to gain fat and harder to build muscle, which further lowers testosterone. Metabolic syndrome and diabetes impair testosterone production through multiple mechanisms, including inflammation, insulin resistance, and effects on the HPG axis. Poor sleep and sleep disorders, particularly sleep apnea, dramatically lower testosterone because testosterone is produced primarily during sleep, especially during deep sleep and REM sleep. Chronic stress elevates cortisol, and high cortisol suppresses the HPG axis, reducing testosterone production. Certain medications can lower testosterone, including opioid pain medications, which are particularly problematic, corticosteroids, some antidepressants, some blood pressure medications, and others. Excessive alcohol consumption impairs testosterone production in the testicles and increases aromatase activity. Lack of physical activity, particularly resistance training, leads to lower testosterone. Nutrient deficiencies, especially vitamin D, zinc, and magnesium, can impair testosterone production. Environmental toxins and endocrine disruptors, chemicals that interfere with hormone function found in plastics, pesticides, personal care products, and other sources, can lower testosterone. Testicular injury or infection, pituitary or hypothalamic tumors or disorders, genetic conditions, and aging of the testicles themselves all play roles. Marcos's story illustrates many of these factors. When we dig into his history, we discover that over the past decade he's gained 40 pounds, mostly around his middle. He's been under chronic work stress. He sleeps only 5 to 6 hours per night and snores heavily. Probably has undiagnosed sleep apnea. His diet is poor, lots of processed foods, not much vegetables or whole foods. He stopped exercising regularly years ago. He drinks alcohol most evenings to unwind. He's on medication for high blood pressure. All of these factors are contributing to his low testosterone, and they're also contributing to his other symptoms, including the sexual difficulties, fatigue, mood changes, and body composition changes he's experiencing. Now let's talk about the controversy around low normal testosterone levels. Testosterone is typically measured in nanograms per deciliter or Ng/L in the United States. The reference range used by most labs is approximately 300 to 1,000 Ng/Dl, with some variation depending on the lab. Traditionally, if your testosterone was above 300, you were told everything was normal, even if you had clear symptoms of low testosterone. But here's the problem with that approach. First, reference ranges are based on statistical distributions of the tested population, not on optimal health outcomes. If the population being tested includes many unhealthy men with obesity, poor sleep, chronic stress, all factors that lower testosterone, then the normal range includes a lot of men with functionally low testosterone. Second, there's enormous individual variation. A man whose natural testosterone level would be $800 might have significant symptoms at 400, even though 400 is technically in the normal range. Third, symptoms matter. A level of 350 with clear symptoms of low testosterone is functionally low testosterone, even if it's technically above the arbitrary cutoff of 300. Fourth, optimal health is different from just avoiding disease. A testosterone level of 350 might be enough to prevent obvious disease, but it's not enough for optimal energy, sexual function, body composition, and quality of life for many men. Modern understanding recognizes that for most men, optimal testosterone levels are probably in the range of 500 to 900 or higher, depending on the individual. Men with symptoms of low testosterone and Levels below 500, even if technically in the normal range, should be considered for treatment, especially if they've made lifestyle changes and symptoms persist. The key is to look at the whole picture: the testosterone level, the symptoms, the individual's previous baseline if known, other hormone levels, and overall health context. So, what should you do if you suspect low testosterone? Let me give you a comprehensive action plan. Weeks 1 through 2 are assessment. First, track your symptoms. Use the checklist we discussed: sexual desire, erectile function, energy levels, mood, body composition, physical performance. Rate the severity and how much they're impacting your quality of life. This baseline will help you and your healthcare provider understand the situation and track progress. Second, schedule comprehensive lab testing. This should include total testosterone, measured in the morning between 7 and 11 a.m. when levels are highest. Free testosterone, the biologically active form not bound to proteins, is often more informative than total testosterone alone. Sex hormone-binding globulin, or SHBG, a protein that binds testosterone and affects how much is available. Estradiol, the primary estrogen, because the ratio of testosterone to estrogen matters. Luteinizing hormone, or LH, and follicle-stimulating hormone, or FSH, to understand whether low testosterone is primary or secondary. Prolactin, because elevated prolactin can suppress testosterone. Thyroid hormones, including TSH and free T4, because thyroid disorders can cause similar symptoms. Fasting glucose and hemoglobin A1C to screen for diabetes. Complete blood count, or CBC, comprehensive metabolic panel, or CMP, lipid panel, and vitamin D levels. This comprehensive testing gives a full picture of your hormonal and metabolic health. Third, evaluate your lifestyle factors honestly: sleep quality and quantity, stress levels, diet quality, exercise frequency and type, alcohol consumption, body weight and body composition, medication use, environmental exposures. Weeks 3 through 4 focus on lifestyle optimization. This is crucial because, for many men, optimizing lifestyle can significantly improve testosterone levels and symptoms, sometimes to the point where medical treatment isn't necessary. First, prioritize sleep. Aim for 7 to 9 hours of quality sleep per night. Maintain a consistent sleep schedule. Create a dark, cool, quiet sleep environment. If you snore heavily or have symptoms of sleep apnea such as waking unrefreshed, gasping during sleep, or excessive daytime sleepiness, get evaluated for sleep apnea. Treating sleep apnea can dramatically improve testosterone levels. Second, optimize nutrition. Eat adequate protein, about 0.7 to 1 gram per pound of body weight, to support muscle mass and testosterone production. Include healthy fats, particularly from sources like olive oil, avocados, nuts, fatty fish, because testosterone is made from cholesterol, and adequate fat intake is important. Eat plenty of vegetables and some fruits for micronutrients and fiber. Minimize processed foods, excessive sugar, and refined carbohydrates. Ensure adequate intake of testosterone-supporting nutrients: zinc from oysters, red meat, pumpkin seeds, vitamin D from sunlight exposure, fatty fish, or supplements if deficient, magnesium from leafy greens, nuts, seeds, whole grains. Consider selenium from Brazil nuts, fish, and boron from avocados, nuts. Third, exercise regularly, especially resistance training. Strength training with compound movements like squats, deadlifts, presses, and rows is particularly effective at boosting testosterone. Aim for at least 3 sessions per week. Include some high-intensity interval training Don't overdo endurance exercise, as excessive long-duration cardio can actually lower testosterone. Fourth, manage stress effectively through meditation, yoga, deep breathing, therapy, hobbies, time in nature, social connection, whatever works for you. Chronic stress is one of the most significant suppressors of testosterone. Fifth, limit or eliminate alcohol. If you drink, keep it to moderate amounts, no more than a few drinks per week. Sixth, lose weight if you're overweight, particularly abdominal fat. Even modest weight loss can significantly increase testosterone. The combination of improved diet and exercise should start moving you in this direction. Seventh, minimize exposure to endocrine disruptors. Avoid storing food in plastic containers, especially heating food in plastic. Choose natural personal care products without phthalates or parabens. Eat organic when possible to reduce pesticide exposure. Avoid BPA in food containers. Drink filtered water. Eighth, consider supplements that may support testosterone. Vitamin D, if deficient, aim for blood levels of 40 to 60 English ml. Zinc, if deficient, 15 to 30 milligram daily. Magnesium, 400 to 500 milligram daily. Some men find benefits from ashwagandha, an adaptogenic herb that may help with stress and testosterone. Fenugreek, D-aspartic acid, and tonkat ali are other supplements with some research support, though evidence is mixed. Be cautious with supplements and choose reputable brands. Weeks 5 through 8 focus on monitoring and adjusting. Reassess your symptoms. Are you noticing improvements in energy, libido, erectile function, mood, body composition? Changes may be gradual, so comparing to your baseline from weeks 1 through 2 is important. Repeat lab testing around week 8 to see if your testosterone and other markers have improved with lifestyle changes. Continue and intensify the lifestyle modifications that seem to be helping. Be patient, because changes in testosterone and adaptation of your body to higher levels takes time. After 8 weeks of consistent lifestyle optimization, evaluate where you are. If your symptoms have significantly improved and your testosterone levels have increased to optimal range, continue with your healthy lifestyle. If you've seen some improvement but symptoms persist or testosterone remains low, it's time to consult with a healthcare provider who specializes in hormone health, potentially an endocrinologist, urologist, or men's health specialist. If you've seen minimal improvement or testosterone remains significantly low despite lifestyle changes, medical treatment should be considered. Medical treatment for low testosterone is called testosterone replacement therapy, or TRT. There are several forms. Injectable testosterone, typically testosterone cypionate or enanthate, injected into muscle once per week or every 2 weeks, is one of the most effective and economical forms. Transdermal gels or creams applied daily to skin, absorbed into the bloodstream, offer steady levels but can transfer to others through skin contact. Patches applied daily to skin are less commonly used. Pellets implanted under the skin every 3 to 6 months provide steady release. Oral testosterone preparations, though historically problematic, newer formulations are becoming available. Each form has pros and cons regarding convenience, cost, effectiveness, and side effects. TRT should be prescribed and monitored by a knowledgeable healthcare provider. The goal of TRT is to restore testosterone to optimal levels, typically aiming for levels in the 500 to 900 range or higher, with the specific target based on symptom relief. Monitoring during TRT is crucial. Testosterone levels should be checked regularly to ensure they're in optimal range. Estradiol should be monitored because some men convert too much testosterone to estrogen, which can cause side effects like breast enlargement, water retention, and mood issues. Hematocrit and hemoglobin should be checked because testosterone stimulates red blood cell production, and levels can become too high, increasing cardiovascular risk. PSA for prostate health, though testosterone doesn't cause prostate cancer, should be monitored in men over 40. Liver function, though issues are rare with modern formulations. Blood pressure and lipids as cardiovascular risk factors. Benefits of TRT, when appropriately prescribed and monitored, can include increased libido and sexual desire, improved erectile function, increased energy and reduced fatigue, improved mood and reduced depression, increased muscle mass and strength, decreased body fat, especially abdominal fat, improved bone density, better cognitive function, and overall improved quality of life. However, TRT is not without potential risks and side effects. Infertility, because exogenous testosterone suppresses the body's own production, including sperm production, so men who want to father children should not use traditional TRT. Testicular shrinkage, because the testicles stop producing their own testosterone. Acne or oily skin. Sleep apnea can be worsened. Increased red blood cell production can lead to polycythemia, thickening of the blood. Potential cardiovascular effects, though research is ongoing and results are mixed. Prostate enlargement, though not prostate cancer. Mood changes in some men. Breast enlargement, if too much testosterone converts to estrogen. Importantly, TRT is typically a long-term commitment. Once you start, your body's own production shuts down, and stopping TRT means your testosterone will be lower than before, often dramatically so, until and unless your natural production recovers, which can take months and may not fully recover. This is why optimizing lifestyle first is so important, as it may allow you to avoid or delay the need for TRT, and even if you do need TRT, lifestyle optimization makes it work better and reduces the dose needed. Let's return to Marcos and see how his journey unfolds. After learning about low testosterone and its impacts, Marcos committed to action. His initial testing showed total testosterone of 320 ng/dl, low normal, but combined with his significant symptoms, this was functionally low. His free testosterone was also on the low end. His estradiol was elevated relative to his testosterone. His vitamin D was deficient. His hemoglobin A1C showed prediabetes. This testing confirmed that multiple factors were contributing to his symptoms. Marcos began the lifestyle optimization phase with determination. He started prioritizing sleep, using a CPAP machine after being diagnosed with sleep apnea, and immediately noticed improvement in energy. He overhauled his diet, focusing on whole foods, adequate protein, healthy fats, lots of vegetables. He started strength training 3 times per week with a trainer who taught him proper form on compound lifts. He began a daily meditation practice to manage stress. He cut his alcohol consumption to 1 or 2 drinks per week. He started taking vitamin D, zinc, and magnesium supplements. He lost 15 pounds over 8 weeks, mostly from his abdomen. When he repeated his labs at 8 weeks, his total testosterone had increased to 480 ng/dl, not optimal, but significantly better. His free testosterone had increased proportionally. His estradiol had decreased. His vitamin D was now in optimal range. His hemoglobin A1C had improved. More importantly, Marcos felt dramatically better. His energy was back. His libido had increased significantly. His erections were firmer and more frequent. His mood was better, and he felt more like himself. His wife noticed the change and was thrilled to have her husband back. Marcos continued his lifestyle optimizations, and by 6 months, his testosterone had stabilized around 550 Ngdl. He continued to feel well and decided to stick with lifestyle management rather than pursuing TRT. He knows that if his symptoms return or testosterone drops again despite maintaining his healthy habits, TRT is an option. But for now, he's maintaining his vitality naturally. Marcos's story illustrates several crucial points. First, lifestyle factors have a profound impact on testosterone levels. For many men, especially those with multiple lifestyle-related risk factors, optimizing these factors can dramatically improve testosterone and symptoms. Second, even if testosterone doesn't increase to optimal levels with lifestyle alone, the improvements in overall health, body composition, energy, and sexual function can be significant. Third, addressing low testosterone isn't just about testosterone replacement, it's about comprehensive health optimization. Fourth, early intervention matters. The longer you wait, the more ingrained the problems become, and the harder they are to reverse. Fifth, you don't have to accept declining vitality as inevitable aging. Many of the changes attributed to aging are actually caused by lifestyle factors and hormonal changes that can be addressed. I want to emphasize something important. Testosterone is not a magic solution to all problems, and optimizing testosterone won't fix a broken relationship, unresolved psychological issues, or other complex life problems. However, when testosterone is genuinely low and contributing to symptoms, addressing it can be transformative for quality of life, health, and sexual function. The goal is not to chase supraphysiologic levels or try to recapture your 20-year-old self, but rather to maintain healthy, optimal testosterone levels that support your well-being at your current life stage. Let's also address some common myths about testosterone. Myth 1. Testosterone replacement causes prostate cancer. This is false. While testosterone can stimulate growth of existing prostate cancer, it does not cause cancer. Men on TRT should have regular prostate screening just like all men. Myth 2. Testosterone makes you aggressive or causes roid rage. At therapeutic replacement doses, testosterone doesn't cause aggression. In fact, low testosterone is more often associated with irritability, and optimizing levels often improves mood. Myth 3. If you start testosterone replacement, you can never stop. While stopping can be challenging because natural production has been suppressed, with proper protocols, many men can discontinue TRT and recover natural production, though this isn't guaranteed. Myth 4. Low testosterone is just a normal part of aging you have to accept. While levels do decline with age, significant symptoms are not inevitable and can often be addressed. Myth 5. Testosterone is only about sex and muscles. While testosterone certainly affects those areas, it has wide-ranging effects on mood, energy, bone health, cardiovascular function, and overall vitality. As we come to the end of this video, I want to leave you with encouragement and a call to action. If you recognize yourself in Marcos's story, if you've been experiencing declining energy, reduced sexual desire, erectile difficulties, mood changes, or body composition changes, don't dismiss them as inevitable aging. These symptoms deserve attention. Start by honestly assessing your symptoms and lifestyle factors. Make the commitment to prioritize sleep, optimize nutrition, exercise regularly, especially strength training, manage stress, limit alcohol, lose excess weight. These changes will benefit your overall health, regardless of their effect on testosterone. Get comprehensive lab testing to understand your hormonal status. Work with a knowledgeable healthcare provider who takes your symptoms seriously and looks at optimal levels, not just normal levels. If lifestyle optimization isn't sufficient, be open to considering testosterone replacement therapy under proper medical supervision. Remember that sexual health is an integral part of overall health and quality of life. You're not vain or weak for wanting to maintain your vitality, sexual function, and sense of well-being. Taking action to address low testosterone is taking care of your health. And now I want to hear from you. What is your biggest pain related to testosterone or sexual desire? What do you feel you're losing? Please share in the comments below. Your honesty might help someone else feel less alone and helps me understand what content would be most valuable. Let's create a community where men can discuss these issues openly without shame, where we support each other in optimizing our health. Remember, aging doesn't have to mean declining vitality. With the right knowledge, lifestyle, and when necessary medical support, you can maintain robust health and sexual function for decades to come. Thank you for watching, and I look forward to hearing your stories and continuing this important conversation. Tentar novamente. Oh, Claude pode cometer erros. Confira sempre as respostas.